Hi, this is CRob80227, and today I want to talk about the subject of universal health care. It's a hot topic, it's in the presidential debates, everybody's talking about it. The healthcare crisis in America is reaching its peak. People are going bankrupt in record numbers. The default rate on medical bills is at an all time high. This is the subject that's on everybody's mind. Now, what I want to talk about specifically about universal health care is the conservative misconceptions and let's just be honest with each other, the conservative scare tactics that they use in regards to universal health care. Let me consult my notes here. There's 4 or 5 core misconceptions or scare tactics that conservatives use, and I want to go over them, and we're going to walk through them together and see if it really makes any sense. If what they're saying has a kernel of truth, if it really is happening, or if it's just an outright misconception, or if it's just an outright scare tactic. Let me consult my notes here. The first one I want to talk about is the conservative idea that healthcare is a consumer product. The second one I want to talk about is healthcare operates most efficiently in a free market. Is that true? Does that make sense? Let's run a sanity check on that. The third one I want to go over is healthcare would be overused if it were made free to everybody in the public. If it weren't rationed out, so the conservative theory goes, the hospitals would be overrun by hypochondriac citizens who just, for every runny nose, they would run to the hospital. We're going to go over that in detail and see if that really makes any sense or if that's just a scare tactic. And the final, or the next last one is healthcare would be totally controlled by the government. This is a conservative talking point we hear all the time. You can't even bring up the subject of healthcare without them saying the government's going to control everything. 5 different bureaucrats will be denying you coverage. Sounds like insurance to me, but we're going to go over that. We're going to walk through it step by step, see if that really makes any sense, see if that's what really happens in other taxpayer-supported services like the police or fire department. Are bureaucrats really controlling everything and denying coverage or denying procedures? And the final one, health savings accounts are the answer. Health savings accounts are the answer, the HSAs, health savings accounts. The idea there is that if you somehow put tax deductible or tax-free money into a savings account, you can somehow save up for your prostate cancer surgery. We're going to walk through that and see if that really makes any sense. I can see by the look on your face you're already saying, no, that really doesn't make any sense. How am I supposed to save up for an illness I don't know I'm going to get? And how am I supposed to save up for an illness that's going to cost upwards of $500,000? I mean, I can't even buy a house for that in cash. Yet somehow I'm supposed to pay for this major illness I may or may not get. Well, we're going to walk through that. Hopefully I can run through this all in 10 minutes because that's the time limit YouTube gives you for subscribers. If I don't get everything in here, go into the comments section. I'm going to add the remainder of that in there and just throw that in there. So if I don't hit everything here, be sure to check that out. The first thing is the most important thing. Healthcare is a consumer commodity. That is where it all begins. That's where conservatives are making the major mistake, and all the disaster that has followed thereafter with our healthcare industry is sprung from that core misconception that somehow healthcare, that illness, is a consumer product. Now, let me consult my notes here because there's a lot of things I wanted to go over. Now, the mainstream American view on healthcare, thank God, is that it's a right of citizenship, no different than your right to police access or fire and rescue services. As a citizen, no matter what your income level is, no matter what your credit score is, if you need help from the police, you have access to the police. You don't get a bill in the mail for $50,000. You don't get a bill from the fire department for $100,000. You just have access to that. You don't need to ration out police services. You don't need to ration out fire services. And the majority of Americans believe you don't need to really ration out healthcare because it is a right of citizenship. The conservatives, however, view healthcare totally differently. They view illness as a consumer product. You choose to get ill, and you can choose to treat that illness. If you don't want the chemotherapy, you don't have to get it. Now, I want you to ask yourself a serious question. I want you to ask yourself this question. Do you believe that chemotherapy is a consumer product? Because that's what this debate is all about. Is life-saving medical services like chemotherapy no different than a consumer product such as a used car or an MP3 player. Now, does that make sense to you? When you think about life-saving surgery for a stroke or a heart attack or treatment for Alzheimer's disease, do you consider those consumer products, or do you consider those something different, something more in line with police services? If you're mugged or if you're raped, those are unfortunate things, and the police will help you, and you don't get a bill in the mail. Now, that makes sense. Everybody can agree on that. Nobody wants a rape victim to get a bill in the mail for $100,000. Or nobody wants to have a rape investigation halted or denied because the victim can't afford, the $50,000, the $75,000 it would cost to investigate it. We've all decided, that doesn't make any sense. We as citizens, we pay our taxes, and we all have access to police services, and everybody gets basically equal treatment. No matter if you're rich or you're poor, if you're raped, the police will investigate it. If you're mugged, the police will investigate it. I recently had something stolen out of my car about 2 months ago. I went to the police. I didn't pay a copay. I just went in, filled out a police report, and just recently, the CD player that was stolen in my car was returned, and I didn't get a bill in the mail. I didn't pay a copay when I went to the police department. I didn't get a bill in the mail after they caught the thief and returned my property. It was all paid for by taxes. And we could all agree that system works perfectly. It's fair, it's equitable, it's democratic, it makes sense. Now, why wouldn't that be the exact same thing for healthcare? But let's just take the conservative contention as face value. What is it about illness that is in any way similar to a consumer product? Well, let's look at what you would do for a consumer product. You can choose what you want to get, right? Let's say you want to buy an MP3 player, or you want to buy a big screen TV. You can choose what you want. And you can choose how much you're going to pay. You can say, well, I want a $200 MP3 player, or you can say, well, no, that's not my budget. I want a $75 MP3 player. And same thing with the TV. And you can also choose where you're going to get it. You can shop around. You can say, well, this store has it for this price. This store over here has it for this price. The internet has it and out of state on eBay maybe for a different price. So you have lots of consumer choice. And the most important aspect is you can choose when you're going to buy that product. Now, if I don't have $75 in cash to buy that MP3 player right now, well, then I can save up and pay for it whenever I want. I can buy it a month from now, or I can buy it a year from now. I control what I'm going to buy, how much I'm going to spend, and most importantly, when I'm going to buy it. I can choose when it's within my budget to get this consumer product. Now, is any of that applicable to illness? Can you choose what illness you're going to get? No. Can you choose how much you're going to spend on that illness? No. Can you choose when you're going to get that illness? No. So the conservative idea that illness is a consumer product is simply not true. I won't go so far as to say it's outright ridiculous. Well, why not? It's my podcast. Yes, it's completely ridiculous. There is nothing even remotely similar between illness and consumer products. Consumer products have choice. You can choose where, what, when, how much. With cancer, with Huntington's disease, with lupus, with Alzheimer's, none of that is a choice. You can't choose what illness you're going to get. You can't choose when you're going to get it. You can't say, well, I can't afford breast cancer or prostate cancer today, but I'm going to save up for it, and a year from now, then I'll go ahead and treat myself to it. It doesn't work that way. Illness is not a consumer product. That's the first conservative myth we're going to eliminate right now. Looks like I ran out of time, but to hear the rest of the conservative myths regarding universal healthcare debunked, check out the comment section below.